Hello, everybody. The Nameless Narcissist here once again, a simple man diagnosed with MPD, giving the facts about narcissistic personality disorder and the things that go on in my head. If you like this video, please like, comment, and subscribe. But keep in mind, I am no clinician. I can only speak to my own experiences and the studies that I read. However, we have a clinician here today, so now I have more credibility again. Um, so I'm joined here with somebody who is a therapist and also has borderline personality disorder, which I found fascinating. Would you like to introduce yourself?
Hi, yes, we exist, therapists with BPD. My name is Andrea Kretschmer. I am a licensed social worker in the state of Ohio. And
OH.
no, oh no,
It was
I
worth a shot.
refuse. I'm from Columbus. I'm from where OSU is. It haunts me. I hate it. I do not
I'm
claim it. I do
flashback.
live there, but I don't claim it.
But yeah, so okay. I guess I'm going to just go right into it. So what has motivated what's your reason for being here? What do you want to communicate to people?
I am I That's a good question. Um, I have always been like, as long as I've been on social media talking about mental health, I have been curious about building more kind of, I guess, cluster B solidarity, and also just being open as somebody who works in the mental health field with a cluster B disorder. I think it's important. I think, um, destigmatizing and kind of closing this gap, this rift in the cluster B disorder community online where people with NPD are bad and people with BPD are good. I think that's valuable to talk about, and to just open up dialogue between us.
Like me and you off camera talked about this a little bit, but just the kind of it seems like there is a big effort with people with certain disorders, personality disorders, or not, I would even say, of everybody wants to have well, we're not this disorder at least kind of mindset, which I intrinsically kind of view as just like, oh, in the long run, this is not fixing stigma at all. It's just kind of putting somebody down for a little bit so you can be up for a second.
Yeah, it doesn't
Um,
serve all of us.
sorry, what's that?
It just doesn't serve all of us, and we all want to be destigmatized and understood and have access to the things we need to do to cope and live a meaningful life.
Yeah. Yeah. I mean, even practically speaking, I say this to people a lot, is that like if we are let's say narcissists are the worst people in the world, right? Maybe we are, who knows? But it's like if we practically speaking, if we want these people to not be hurting people, then we need to view them humanely, so that they can work on themselves and that they're comfortable working on themselves. Same with borderline personality disorder. I mean, I have a sister who has borderline personality disorder. Difficult thing to deal with. So, what do you think? So, I'm curious. This is something that I find really interesting. Do you think that how has your borderline personality disorder? Do you think it has impacted your ability to be a therapist or gave you unique challenges that you wouldn't have experienced otherwise as a therapist? That kind of because I know that like I guess where my mind goes is that obviously people with borderline personality disorder struggle with boundaries, right? And boundaries can be very important in a therapeutic setting. How do you think that's affected you, I guess?
Yeah, so that's something that I find interesting. I think that's something that even without borderline personality, like people will struggle with that.
Yeah.
Um, it's hard when you're like in a human interaction with somebody, and I'm very laid back. I mean, I don't think anybody's coming to me being like, oh, this person covered in tattoos is like gonna be uptight and asking me very
Right.
formal questions. You know, that's I always kind of question. I'm like, oh, well, did that follow the guidelines of ethical self-disclosure? Was that helpful? Am I trying to produce an outcome? Am I trying to make sure that my clients like me? Right. And I think those are things therapists struggle with to some degree in general, right? It's kind of it's a job that just kind of like relies on you being a low-key insecure in some ways. I worry when people aren't, honestly, when they aren't constantly revising and reviewing everything. Um, and engaging in a lot of self-reflection. But I've noticed what affects me most, I don't think is actually my work with clients, but how I deal with power differentials. So in Ohio, right, like I don't have a graduate degree, right? So in Ohio, that means I can practice psychotherapy under supervision in an agency setting. And so my scope is limited, right? And so since I have to be under supervision in an agency setting, there's a lot of opportunity for the kind of power differential of a supervisor and a clinician to like surface some of my issues.
Yeah.
And that's actually been the challenge. Is this, and I actually, we were kind of talking about this off camera, this kind of constant paranoia of like, I'm doing something wrong. Since I am self aware and I know that maybe at times I lack insight into my behavior or how I do things, like, what if I'm doing something wrong and I don't know it? And so then when I get a lot of like praise from, supervisors, colleagues, like I won an award recently and I didn't even show up
Nice.
to the ceremony. I was just like, nobody knows me. And then I got the notification. I was like, oh shit, oh man, that's awkward. But it's like people think I do good work. My clients tell me that, they value me in their lives. And I'm just like, well, I don't know. I still feel just like a actual piece of human garbage most of the time. I'm so worried I'm doing everything wrong. Um, and I've noticed when I get into that space, right, when I have this critic and this paranoid part of myself that is constantly worrying about that, that is when I actually start to screw up. So
Yeah.
I need to be really mindful of that. That's when I try to like bulldoze, I try to force things, I try to be like by the book. We're doing the DBT skills and I'm not valuing what you in front of me are doing. That's when I get into trouble.
Yeah.
Um, but again, it's like I've had years and years of recovery under my belt. I've been in therapy. I've been diagnosed for a long time, like 14 years. So I know, right? Yeah. And people will be like, you don't have borderline. I was like, most days I don't.
Not anymore, at least.
It's not so much.
Like
But
something
yeah.
I noticed when I when I, especially when I was in the army, what would happen is when I would get very self-critical and self-doubting, is that I would like, and I'm not sure if this is even relatable at all, but like people would be like, "Oh, you did this thing wrong." I'd feel humiliated, and I would like hyper fixate on doing that one thing right. Then
Mm,
everything around me, I like would just like go out of control because I wasn't even thinking about it because I couldn't because I was only focused on things I already did wrong.
yeah. That is like a very relatable human experience.
Yeah.
Is like if you just focus on the thing that you're doing wrong and you're trying to like constantly self-police, right? There's this whole other situation. Like I could be really focused on fixing my faucet and not recognize that my living room is on fire,
Hmm.
you know? I'm like, this leaky faucet, man, I gotta
At least we're
fix
getting a faucet fixed, in fairness. Um, but so, well, okay, so you've been diagnosed for 14 years.
it.
Again, like almost mind blowing. I mean, wait, how long? Because I thought I've been diagnosed for a long time. I can't even put a number on it right now. I've been diagnosed for a while.
Mhm.
But so how did that process go for you? What started you getting diagnosed and what happened?
Yeah. So, to be clear, I have been in and out of therapy since the age of 6.
Nice.
So, yeah,
Also,
I right, yeah. I feel like, that's a lot of cluster experiences. Whether or not we get diagnosed with the right thing later on down the line
yeah.
kind of varies. But yeah, so I started going to therapy when I was 6, and I always knew that I could ask to go to therapy if I needed. So when I was younger, I got treated for PTSD, um, and like some OCD kind of issues that I was having. And then I was like, I don't want to be here anymore. I'm fine. I'm gonna lie. I'm gonna get all these little treats that I get for doing my therapy things. Um, and then, lo and behold, turns out that didn't serve me because the that manifested an eating disorder later down the line.
Oh,
um,
nice.
yeah, and so I was working with an eating disorder therapist from the age of like 14 to 18. And she's the one who ultimately diagnosed me. I was in and out of like longer term residential eating disorder care um, from the age of like 15 to 17. Um, and a lot of my behaviors really escalated during that time. And the eating disorder actually kept them down, right? Like, I basically just starved myself out of any borderline behaviors that I could have been exhibiting,
Yeah.
essentially. Um,
I don't
and
have
so
the energy to be impulsive right now. Yeah.
Literally, yeah. And so when I got out of treatment, when insurance kicked me out, let's be honest. When insurance kicked me out of eating disorder treatment, my behaviors were really, really bad. Um, a lot of impulsivity, a lot of like reckless behavior, a lot of like acting out, screaming at people. My grades plummeted, all of these things. And so I got sent to a psychiatrist who was treating me for bipolar disorder, which I have a family history of, but didn't have any symptoms of in the way that we would, actually diagnose someone with bipolar disorder. And so after being medicated for a really long time, being on like high doses of antipsychotics, and just feeling like trash, I was to my eating disorder therapist, I was like, something's not right. Like something is wrong here. Like the meds are making me feel like crap. I'm still having symptoms on top of that. Um, and so we looked at borderline personality. Um, and that is a diagnosis that fits me really well. Um, that is just what has stuck.
It's like this is a little like personal pet peeve of mine. I just have to say it because like the eagerness of some psychologists to diagnose bipolar disorder when it's clearly personality pathology.
Yeah.
Oh my God, it makes me. I literally got into an argument in inpatient with my doctor when he asserted that I had bipolar because I was like, my mood swings don't last 2 weeks, and he's like, you don't know what you're talking about. It's like, yes, I do. Like, it's not like it's very cut and dry in this case.
Yeah. Yeah. It's like my moods would switch so quickly, right?
Yeah,
And like come to find out years later, this whole time I had ADHD and was recommended to get assessed multiple times by like teachers and all of this stuff. And so that contributed to a lot of that. But the seeing that as bipolar disorder, because like my uncle had it, my uncle
yeah.
is schizoaffective, bipolar,
Mhm.
and just seeing like, oh well, your mom's brother has it, therefore you have it. And I'm like, when it's very, very clearly, especially if I've had all of these other risk factors, like already got treated for post-traumatic stress, had an eating disorder, like was starting to struggle with substances. I'm like, those are all things that, yes, we see those things in bipolar disorder. But when I think of those things, I'm like, ooh, somebody's struggling with some deeper down kind of like personality issues or some sort of attachment trauma.
Yeah.
Um, that would be the more likely thing.
No, like agreed. Like, oh my God, it's actually that's a good segue into another question I have. Like, so flaws in the mental health system, just in general. What do you? Yeah. Well, oh God, I feel like you have thoughts. Um, what do you feel? What do you feel like are like some of the? Because I've been in and out of the mental health institutions basically my entire life. But what do you feel like are some of the biggest like detriments to actual treatment for people in these systems as we see them today?
Are you talking about like people in general or people with personality disorders?
Um, I guess I was talking about people in general, but let's go with people with personality disorders just
Because I
because,
was like, in general, we might be here for a while. Just
yeah.
like pull out a
Okay,
scroll.
we'll
And,
just specify real quick.
well, yeah. Well, if we're like limiting the scope to personality disorders, right? Just lack of training,
Yeah.
lack of interest in education on personality disorders, which contributes to clinicians not being competent in their literacy of personality disorders or not understanding it's not just a behavioral phenomenon, that it has a lot of roots in people's early experiences and their biology and knowing other things to look out for when people have personality disorders. Um, you know, and this in addition to like not being competent to like see them, right, or understand them and diagnose them. And then people collect like a laundry list of diagnoses, quite like I did, right, where I'm just like, I don't have all of these things. Or it would be things that I was like I think in my chart it's like general anxiety disorder, major depressive disorder, like deliberate self-cutting. And I'm like, oh, we're using a lot of words to describe one thing. Like, it's not necessary, and it can be so confusing for people with personality disorders to collect an entire alphabet, right? But not only that, but when it comes to actual like practice with people, not knowing how to manage the countertransferential issues. It's like
Yeah.
people with personality disorders might give you the ick. They might activate your stuff,
Yeah.
and knowing what to do about that and having good awareness and self reflexivity and having good guidance on how to navigate those relationships is really important. Like if somebody that I'm working with is telling me, oh my gosh, you're like the best therapist I've ever had, you're my favorite, I'm like, okay, I'm noting that. And then maybe later down the line they have another thing, or they hate me, or they start to pick fights with me or something, and I'm like, oh, okay, I'm curious about that. And like I'll observe that over time, and I don't have the licensure to diagnose, right, but I do refer people for reassessment.
Yeah.
Or if we're not worried about diagnosis, right, it's like that's still something that the person's exhibiting, and I do have a good framework of how to navigate that. But that is not because I've received some training through my institution, like my schooling on how to do that. Like at Ohio State, right? I think my old supervisor who teaches this class is fixing this, but in the psychopathology class, um, they literally talk about like the Myers-Briggs personality types when talking about personality disorders. And that is a graduate level program.
Are you
So
fucking serious?
yes, I'm 100% serious. So I
So
think it's been
I,
revised, but like
I'm,
literally, yeah, just
I'm so
all
sorry. I want to clarify to people really quick
over it.
because people would not understand the reaction I had to that. Is that the Myers Briggs is not statistically validated in terms of actually identifying consistent personality traits, and the fact that it's being used in an academic setting in that way was mind blowing to me. But anyways, I just want to clarify that in the audience. But
Yeah.
continue.
So that's the playground, right? That is
Yeah.
what a graduate program where, and this is the thing that really bothers me, right? Somebody can do a year or 2 year program in that program where that
Yeah.
nonsense is happening, and then go out in the field, um, and work toward their clinical hours, right? And still never like actually work with somebody with a personality disorder. And or they do and they don't actually know what they're doing, or they might start to avoid that client, or they might drop the client, transfer the client because they're uncomfortable. Like there are clients that I've had over time where people are like, even the way they introduce them to me, I'm just like, okay, they probably have a personality issue, and I'm like,
Yeah.
that's fine, no shame here. Like, but the way they talk about them is just so frustrating, and it's indicative of a lack of awareness and training and ability to learn to manage the self so that doesn't show up in our work. But it's like there's just I don't think we've talked about the 5 factor model or the MMPI since I literally was doing my associates. So
So like
Myers
the actual personality assessments
come up
just
twice
don't get
though.
talked about. Of
Yeah,
course not. Why would that? That would
yeah,
be crazy to actually use things that are statistically validated, but whatever.
yeah.
You're like literally, I'm like sitting here thinking, man, I tell a lot of people to seek out therapy and stuff like that. And I'm like, maybe I shouldn't be now.
I tell people to see a specialist.
I think that
Like
might
if you
be
can't
the route
see
I
a
take from now on.
specialist, yeah.
Because I mean, oh my God. And I feel like a big issue with it too is that like not everybody is going to be able to handle, not every therapist will be able to handle like the countertransference that happens with people with personality disorders. And I think that's fine. Like if you can't do it, but I feel like
There
they
are
still
other
need to be
people
trained
who
to
would.
recognize those signs of when they need to
Yeah.
refer them to somebody who specializes, and they just aren't. I mean, fuck. I had a friend who she got her psychology degree. She took one abnormal psych class, getting that degree, and that was it. Now she's treating people. That's cool.
Yeah, I will say it's like, yeah, I'm very skeptical of a lot of the kind of like training and like accreditation that people get.
Yeah.
Um, and yeah, it's like it's necessary, right? Like I think if you're going to be working with like mentally ill folks and vulnerable populations, like you need to be trained, but the training is woefully inadequate
Yeah.
in so many programs. And I think that does a disservice to people
Yeah.
who are deeply suffering. Like personality disorders are severe mental illness. Like,
I mean, we like, I mean, the suicide rate alone in personality disorders is like mind-boggling. There's one study that was done in Montreal that it was like they basically they tracked a bunch of people who had cluster B disorders and their life outcomes. It was around 20% of them just, did the unthinkable,
yeah,
um, which is insane. And it's insane we don't have more treatment options available and that you have to be so, and like that's why I always tell people if they suspect they have personality disorder, you have to go to somebody who is like an expert in personality disorders proper, as opposed to just any clinician. Oh my god, terrible! I hate it. Okay, um, so oh, I don't know which one I want to. I have two pertinent questions. I don't know which one I want to go for first. Um, so how about screw it. It's a little bit better this way. So, so you have clients who are cluster Bs, specifically BPD and NPD.
um, ish.
Interesting way to answer that.
Yeah, it gets really hard, right? Um, when some some people that do the assessment and diagnosis
Yeah.
um, do not believe in these disorders or diagnosing people
Yeah.
with them. Or it's not necessarily as much of like a formal diagnosis or diagnostic process unless that's what people want. But I'm
Yeah.
like, oh, I've noticed like traits, like I'm noticing traits of things that are forming a new pattern over
Yeah.
time, um, and just getting like an understanding. But I don't think right now I have anybody with formal diagnoses in this area as much as people who are seeking diagnosis.
Gotcha. Okay. Yeah, have you in the past?
Yes.
So, I guess so being cluster B yourself, how was treating people with cluster B personality disorders?
I I don't really I don't know how to answer that as like
It
from a
was
like
very open ended. I
yeah,
realized that right after I asked.
yeah. I was just like, well, I don't know what it's like to not have a cluster B disorder. And
Yeah.
so what I think is really interesting is that I think it hurts when people feel really understood.
Yeah.
I think they're like not used to it. Um, yeah. And
I'm
I
definitely.
feel that's especially vulnerable for people with NPD or for people who have traits where they like might hurt other people because
Yeah.
of their emotional things. And I'm like, like that's a moment, in my work with people where I'm like, no, 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 I get it. Like vengeance, sometimes it feels really good, but then it's like you got that the aftertaste of shame because it's
Yeah.
not actually in line with your values to act that way. And I think that's where you're struggling, right? It's like you're harming people, but you don't want to harm people. You know you're being mean, you know you're being cruel, but you don't want to. And so then you devolve into shame, and the shame feeds the cycle. Um, so I think being relatable in that way, or just having done a lot of that work um, myself and unpacking a lot of the ways in which I used to behave creates a space for people where it's like I don't pussyfoot around it. I don't pussyfoot around self-harm. I don't shy away from the topic of suicide. I don't shy away from how the internal process that would lead to like abusing somebody else. having really sat in that and like grieved my way through that and, recognized how therapy skills like doing DBT, learning to regulate my emotions, being mindful, being direct, can reduce a lot of that and get us acquainted with ourselves. And, you know, I think that can be jarring for people. Or I remember distinctly as an adolescent when I would share that I had harmed myself. I remember my therapist asking to look and just like kind of gawking at it and like not really knowing what to do. And that is so far because that was my experience and I know how gross that felt and I was so tired of everybody not responding to me, right? When I would be vulnerable and share that I had been hurting myself, right? That like I don't leave people stuck in that spot, or at least I try not to because I do understand it. And so I think, whether somebody is engaging in those things because they have a personality disorder or they're just traumatized. Like, let's be honest, I work in community mental health. Like, people are traumatized
Yeah.
beyond belief. And so it's like, because I've been there and because I've made so much progress in that way. And I've been suicidal. I've attempted suicide. I've hurt myself. I've hurt other people. I've screamed at people. Like I have been abusive to other people. And I have done a lot of work to undo that and lead a more values driven life where I am able to respect others and treat them kindly. You know, I think that is just a different experience than what a lot of people, including myself, have experienced in
Yeah.
therapy.
I mean, like, it's, I imagine for a lot of people, I imagine it's refreshing. I mean, I have, like, my therapist, she's only treated like 5 people with personality disorders. She doesn't have much experience in it. And there is a lot of times, especially early on in treatment,
Mhm.
where I felt very misunderstood or I got a response that I took offense to, stuff like that. And so I can see it being a benefit in a lot of ways. Just it's very circumstantial, obviously, though. Um, I had I had something that was so important. Oh, do you disclose to your patients that you have these diagnoses? Because I'm kind of curious about that.
It depends.
Yeah.
Um, so like I will disclose, I will really readily disclose that I have ADHD because that is something that actually affects my work quite a lot.
Yeah.
Um, like especially when it comes to like time management and like getting distracted by things. I'm just like,
Mhm.
oh my God, I was supposed to be looking at you directly in the face. Like those are the things that kind of come up more often. Or I'll work with kids with ADHD and I think they don't want a neurotypical person bossing them around. And I'm just like, nah, my brain's like that too. Let's work
Yeah.
with, let's figure out what's going on. And also how much shame have you internalized through how people treat you already? Let's unpack that and so we could then learn how to clean our rooms or do something like organize our schedule. um so I will say like in those moments when people have, you know they're coming to terms with this or they're seeking diagnosis, or they're looking to pursue different treatment like DBT groups, stuff like that, and or they have these moments of grief even if they don't have BPD where they're just so oversaturated with the emotions and um, just how traumatized they kind of are, um, and they worry that things will never get better. Like those are moments that I have disclosed that,
Yeah.
or you know, um, when people are like I've had client families be like, I don't know if this is right. I think they might have this. I don't really know. And I'm just like, well, why do you think I'm here? And they're like, oh, do you have it? And I'm like, yeah. Why do you
Yeah.
think I'm um, and having that especially when I work with parents whose kids' behavior resembles a lot of how I used to act. I'm like, I used to be this kid. Swallowing a whole bottle of pills is not on the table for me anymore, though. I'm like, there is a path forward. It's gonna suck. It's gonna take a long time. Like, I'm not gonna sugarcoat it for you.
Yeah.
Um, I'm gonna be realistic, or I'll tell people, I'm like, I don't feel like that anymore. I know you feel like that right now. You might not always feel that way. So what if we don't make big decisions about it? And it doesn't come off that like brusque, but you know,
Yeah.
genuine empathy where I'm like, I know what it's like to feel this horrible. And I know what it's like to feel like this horribleness will never end. And so you want to end it yourself.
Mm,
And I was like, you might not find big reasons to live. It might just be that you like how the wind feels on your legs in the summer. You really can't wait for your favorite artist to release their next album. Like, it's not the big things. And I'm sorry people got all corny in the hospital about it. It's the little things that keep us here.
yeah,
And I feel like that does being open about that creates it normalizes it, right? That doesn't mean I launch into like horrible traumatic things that I've been through. Sometimes I let a little bit of lore slip here and there. I was like, oh yeah, remember that time that I was homeless? And then I was like, oh shit, I shouldn't have said that. But again, like it's not these like horrible, unforgivable like slips.
sure.
Um,
So
but
that's I love that. That's interesting. So I guess like in a similar vein, if there's somebody here who's like watching who has NPD, BPD, personality disorders in general, whatever, what's the thing that you feel like helped you the most in your recovery, and what would you advise for them?
mm, that's a tough one. Because I always feel weird when I get asked this question because people will ask me, "Oh, like, well, did you do DBT? Did you do this?" And I'm like, "I didn't. I didn't do the traditional course of
Yeah,
treatment." A lot of the treatment that I got, like, although it kept me alive, was kind of harmful, if I'm being honest. Like, residential treatment was pretty bad. And I went to a nice place, and that didn't protect me emotionally from a lot of the treatment that I got. Like I got called a narcissist in front of a group and was asked to forgive an abuser of mine in front of a group when I didn't want to. Like stuff like that, where it's just like it's not an emotionally safe environment.
right.
And it really taught me to be really self-reliant and didn't take into context any of like my early experiences or what my family life was like. I was in a substance using home. Nobody had thought about that though. Or like I didn't know because it was just my normal, right? And so I struggled off and on, and like it was in the moments where I blew up my life that I made big changes.
Yeah,
And I became a Buddhist for a while. So people get the impression that I've done DBT, and I'm like, no, I went to the source of the acceptance skills. And I started, like, I became a practicing Buddhist. Like, I would go to temple, I would wake up, I would meditate, I would pray. That's how I learned mindfulness. That's how I learned acceptance. That's how I learned to be courageous and change. And at the time, I was also working with a therapist who, didn't believe borderline existed. I told her
of course.
like during our like intake, and she's like, and I was like, girly pop, that damaged me, emotional damage. Uh,
Literally, like that would have made me like so upset. Oh my god! Like I imagine it's like the same. I imagine it's the same feeling of somebody borderline doesn't exist, or of me going like I get into inpatient. I'm like, yeah, I have narcissistic personality disorder, and they're like, narcissist can't be self-aware, and I'm like, fucking. Now I just want to hurt you.
Yeah. Yeah, and I was like at the time, that was like I saw her for like 6 years. So she was really helpful for me. She was very non-judgmental. She sat with me while I was using a lot of substances, while I was in like really volatile relationships, while I was being very unempathetic and a little cuckoo bananas. And so it was that in and of itself, there are moments that I will treasure from that relationship, but at the same time, like, you know, there were major issues with it. She was going through a lot of stuff at the time that I think showed up inappropriately in our relationship, and there were some like boundary issues there where I think she felt too close to me, and that is ultimately what pushed me away. Like I had like a harsh like I gotta bounce. And it was like kind of this like a lot of things boiling up to that, and I just felt like I couldn't express myself. But now I'm doing therapy that really helps me. Like my therapist does EMDR, DBT, and IFS. So we really just do IFS and EMDR. And I find that really helpful for helping me kind of um, resolve some of the deeper down issues. I would love to actually get behavioral therapy though. I've been looking for that because that's the thing that I never quite got.
Yeah.
And those are the things that are very difficult for me to manage day to day, but it's more for ADHD now than it is for I don't really have, like, big behavioral BPD symptoms anymore, like, at
Which,
all.
congrats, by the way.
Emptiness, fears of abandonment, check, check, check. Identity problems, check. Like, if I change my clothes or my lipstick, I'm a new person. Duh.
Felt, yeah.
Yeah.
I had like me and my one of my close friends, Tess, also known as Spirit Narc.
Mhm,
She me and her have a very similar experience where like it's not as pervasive, but
mhm.
if we go through like a really bad life event, we'll just completely change how we look and like start over more or less because it's like, oh, now we're different. It's fine.
Yeah.
I oh my god, it's so much.
Mhm.
Um Crap, what did I this is why I have to write everything down because I had something that I really wanted to ask. I don't remember. Oh, what BPD symptoms do you still exhibit?
Ooh, yeah, so this is a hard one to answer with
At
ADHD, right?
least, yeah, at least, and when I say exhibit, it's like, okay,
Yeah.
like internalizing symptoms is basically remission for us. 99% of the time is what it seems like.
Not
So the
the
things
remission
that still
that I
in
crave.
what's that?
Not the remission that I crave.
Yeah, like
Yeah,
earnestly. My God.
yeah.
Um, but the ones that I guess just the ones that are actively impacting your functioning as opposed to the ones that you still experience. Because I mean, let me put it this way. I don't think I'm ever going to be in a space where I'm not craving admiration, but I go about it in healthier ways, whatever.
Yeah. Yeah, that's the thing where it's like I feel like I've actually gone about some of these things in healthy ways at this point, and so, like, the defaults kind of aren't the same, like, the
Yeah.
emotional experience might be the same, but the fears of abandonment, I don't go about in, like, sneaky ways anymore, I don't routinely abandon myself anymore, um, healing that external and internal attachment has been pretty good, that's gonna be the long game. That fear of abandonment is still there. It's something I feel very acutely. And as somebody, it's weird because it's like I have that fear, right? And I also am on the disorganized avoidant end of attachment things. So I will feel quite like paralyzed when I feel that, and then I will generally I will avoid.
Yeah.
Um, and that feels, like, safe to me, that feels like I can be myself, but the more I feel that, the more kind of, like, preoccupation I exhibit, which is uncomfortable, and so there's this kind of, like, pendulum effect and all of that. The emotion dysregulation, it is what it is. It's gotten better since my ADHD has been managed with stimulant medication, that's, like, a big thing. That's why it's, like, it's hard to tell when you have ADHD, and my biggest things that I struggle with are that aren't attachment related are the emotion dysregulation and the feelings of emptiness.
Yeah.
Like I feel like an empty void most of
The
the time.
I actually read a study and it showed that it's interesting because I read this study that was like, okay, what are the symptoms that generally just don't go into remission for personality disorders? For NPD, it was the need for admiration, and for BPD, it was the feelings of emptiness. And I found that very interesting.
When I say we're cousins, this is
Yeah,
what
too.
I mean. Yeah, it's like the emptiness and filling the void, right? It's, and it's like I can feel that when I'm not around people as well. And that's where it is that kind of attachment related thing. So it's like learning to discern is like, oh, is this the BPD? Is this the ADHD? Like, how am I experiencing these overlapping symptoms?
Yeah.
Is really interesting. Like when I'm just like, oh no, I'm all alone and now I don't exist. Like that's different. Or like I'm all alone and now I don't feel anything inside versus like the I am so bored and I need dopamine and I need to go like run and jump off like a tree or something. Like
Been there.
need to go be a little wild animal in the woods for a little while until I feel like a person again.
So this is something I found really interesting because the feelings of emptiness. So my because like I both people with MPD and BPD both like experience this, but they seem to describe it in different ways. So I'm curious how you experience it personally.
This is the thing. So many people ask me this question. I'm like, how do you describe something that isn't?
I'll like I'll explain how I experience it almost as a physical feeling. of like that I'm just like a hollow shell that like my ribs could collapse in on themselves at any moment and shit like that. Or that like it's just that I don't feel like there's any substance to my character and everything. That's generally how I try to describe it, at least.
Yeah, that's interesting. I think I think even though it's a symptom I experience still, I have a hard time kind of contextualizing it in like borderline because for me, for me, it feels like still so blurred with like the ADHD and just feeling so bored and like empty and like, nothing will satisfy me. Like I think that's when I start to feel like what I am often inconsolable, right?
Yeah,
Like I am like a toddler pushing away all my options to be consoled. It's like mommy, no, daddy, no, toys, no, nap, no. Like that's kind of like how I get when I feel that way. Um but yeah, I think in the past when I felt that way, that would really lend itself to, like, my kind of, like, depersonalization and
yeah.
just feel like I'm just a sim. Like, I'm just walking around and, like, I'm not in my body. Like, I don't feel my body. I don't feel anything. Um,
I get it. Yeah, yeah, that makes sense. I'm like,
yeah,
honestly. Oh
just like,
God,
"Whose hands are these? I don't know her." Like
it's like I don't know if you experienced this, but something me and Tess have talked about before is like I'll look in the mirror and it's like it feels like I'm looking at like a video game character. I don't feel like I'm like actually like a person. I just like I don't know, like it's weird to explain, but it feels like it's my fucking avatar. It's not who I am.
yeah, yeah, there's, like, that rift in your, like, consciousness where you're just like, "That's not me." Um, that
My
like, whenever we this comes up, right, I remember so this kind of lends to, like, how did I turn out like this, right?
yeah,
I was a very often inconsolable child, right? And, like, my mom had this, like, headboard that had a mirror on it, which I'm, like, perverted looking back, but you do you. Mom, dad had a healthy sex life, I love that for them. Um
good for them.
I mean, they were they messed some stuff up, they raised me sex positive, I'm not complaining. I'm not complaining. That's not something I experience a lot of shame about. So, um, like, I would go to my there's this memory, like, seared into my mind, I was probably, like, 6 or 7 at the time, and I was trying to co-regulate. I was upset, I was crying, I wanted my mom to make me feel better, right? That is what children do. That is
Yeah,
what moms and parents and caregivers do. They help children regulate their emotions and offer comfort, and I remember just, like, crying, and she was ignoring me, um, and she was just, like, watching TV, and
yeah.
I just started looking in that mirror and just, like, crying and just feeling myself, like, leave my body, and then she's like, "Stop looking at yourself, you're so conceited." And I was like and I'm like, "No wonder." I literally sometimes, like, I cannot cry unless I'm looking in the mirror to know that it's, like, literally real, or I have trouble having my emotions when I'm by myself.
Yeah,
It's just, oh my god.
my emotions feel so performative even when I'm alone, if that makes sense. It's like even when I'm alone, I'm like, oh, I'm just doing this for attention, even though that there's nobody around. But it's like it feels so theatrical. I always feel like
Yeah.
there's a fucking camera on me.
We internalize how other people reacted to those emotions, like,
Yeah,
habitually, like, if I, like, I also had a therapist when I was, an adolescent, when I had gotten out of eating disorder treatment, I was acting all sorts crazy, right?
yeah,
I called because I was like, "I'm just trying to call and have support," and she more or less said, like, "If you cry wolf enough times, people will stop coming." And I'm like, these are the
yeah,
things that form how people, like, are going to interact with their emotions in the long term, right?
yeah,
And, if we're told constantly that, well, when we have, an emotion that we're doing it for attention, if you're just crying for attention, "Stop crying, I'll give you something to cry about." Like, how are we supposed to have a healthy relationship with our emotions
Yeah.
and then not feel like our emotions are trustworthy messengers from our body later on and have some sort of ulterior motive. Like even when I'm alone, I'm doing it for attention.
Yeah, that's right. Like, oh man, that so that's stuff like I'll give you something to cry about. Jesus, my and, like you just like gave me like a flashback. And I'm like, oh fuck, I don't want to think about that. Okay, so okay, next thing. I have like two or three more questions, and then we can call it quits. But the contentious topic, narcissistic abuse, the term itself. How do you feel about it, and what would you communicate to people about this term? Because I have complicated feelings on it, of course. I think it has pros and cons, but getting your perspective, I think, will be interesting for this.
So, to keep it as short and sweet as I can, I wish we lived in a culture that took abuse seriously enough that we would not have to qualify it by adding the term narcissistic in front of it.
Yeah,
I think a lot of the times when people are describing narcissistic abuse, they're describing emotional abuse, um, and they're describing a relationship with a type of person um, who is abusive. And they might not actually have the clinical chops to determine whether or not that person's somebody with narcissistic personality.
yeah.
And, you know, um, I've just seen a lot of negative come from it, but I know you feel differently about it.
I
Ish.
mean, it's like I have. It's complicated for me just because I feel like one, I think that it can be very comforting for people to understand the suffering that they've went through the
Mhm,
lens of a cause and a pathology. But at the same
mhm.
time, it's like, oh, we view almost all abuse through this lens of narcissism nowadays, and I feel like that can be incredibly damaging, especially if they're trying to seek some kind of what's the word? Some kind of comfort out of this. And it's like, okay, what about paranoid personality disorder? I've seen a lot of people who are like, oh, like somebody expressing paranoid personality disorder traits and is hurting people, and
Yeah,
then they're like, oh, well, that's narcissistic. They were always accusing me of cheating, and I was like, that's not really narcissism right there.
yeah.
Um,
That I'm like, that could be borderline, that could be paranoid personality. Hell, that could be like
or
schizotypal. Like
yeah,
that could be
or the controlling aspects of
yeah.
obsessive compulsive personality disorder.
Mhm.
There's
Could also
there's so
not
much.
be a personality disorder.
What's
Like
that?
it could also not be a personality disorder. It could
That
just
too.
be
They could
someone
just
has severe attachment trauma, or they might have
yeah.
depression, or they might have bipolar, or they might be experiencing psychosis. It could be anything.
Yes. Yes, hands down.
Substance disorder, right up there.
And that's like so I guess like I and that's why I kind of view it through this lens of I generally have a negative view of it, but I don't get mad at people for using it because I'm like, I get how that makes them feel confident in certain ways. I'm just kind of like, nah,
Yeah.
fucking whatever, you guys do you.
I think, yeah, I always think that people, I think a lot of this has to do with a lot of this conversation happening in short form online, right? Where
Yeah,
people are being reactive or aggressive or digging their heels in because, that's what the internet likes.
yeah.
That's
That's what
that's
gets
how
you used.
it's online, right? And so I think people will often think that I'm being combative when I say like, "Hey, can we please actually just call it abuse or call it emotional abuse or describe the behavior?" And I think my partner one day is just gonna not do anything. I was gonna say they're gonna kill me, but they're not. I don't they could try.
Don't come at me.
No, just
Don't.
kidding. They were a wrestler. I'm like, I can't take them. They're
Yeah.
too strong for me. They know too many moves. I'm just
Yeah.
weak. But my partner always bugs me that I'm really precise about language, and this also comes from taking 6 years of Latin, so it's just where I
That's
am with
so
things.
cool. Oh, I'm jealous. I have a book on Latin that like I have two books on Latin that and I got pretty good at it, but I just can't. Language is so
It's
hard for me.
it's something that comes pretty easily to me. It's like people are like, "Oh, you're learning Welsh," and I'm like, "Yes."
Of course
And
I
they're
am.
like,
Why wouldn't
"Isn't
I?
that hard?" I'm like, "No,
A
It's actually
language, a
yeah,
dying language. Let's learn it. Fuck it.
but like anyway, I'm very precise about language, and what I always recommend is that it's like if you want people to understand the behavior that you experience from somebody else, you can describe the behavior. You can describe how it made you feel. You
Yeah.
can call it what it is. It's abuse. It is harm. It's trauma. Um, at the same time, it's like when we're saying this happens with borderline too. It doesn't happen, as much, but when we're throwing the label of like narcissistic or borderline in front of it, it's like we need to understand that's a very marginalized mentally ill population,
Yeah.
right? And the language that we are using affects them. It affects, their ability to come forward, feel valid, or, I have called out so many mental health practitioners, people who have so much more experience than I do, for being so stigmatizing toward people with cluster B disorders. I got a training like kind of advertisement recently. I get a lot of those. I'm like, where, how did y'all find me? But it's like
Leave me alone.
how to spot narcissistic abuse. So this is being lent like clinical credence when I find it so troubling. And like I said before, I want us to live in a culture where we take interpersonal violence seriously
Yeah.
and we can put it in its appropriate scope and describe it effectively and without using this language that harms people.
Yeah.
Like, I don't want to see I'm not trying to dismiss people who have been survivors or done this, and whenever I bring this up, people are like, "Well, you haven't been abused." I'm like, "Whoa, whoa, calm down."
Like I got a story for you.
Like, literally, and it's so frustrating because it's like, I am also this way when it comes to talking about, like, things like sexual violence, right? And people are like, "Well, you clearly haven't been, like, raped or abused," and I'm just like, "I'm not gonna get into my experiences," but, like, it's always so dismissive to me when it's like you couldn't have possibly endured this trauma and want healing and restorative justice. You couldn't possibly want understanding for the person who harmed you, because I'm always going to be on the side of like, when I've harmed people, I didn't want to. It was
Yeah.
not my intent. That is very rare for people as a trait, to be sadistic, to take
Yeah.
pleasure in harming other people. A lot of us hurt other people because of the ways that we have been conditioned or harmed, or the ideologies we've been socialized into, and that's not fair. And so I am always pro using more words to describe really complex situations and experiences, and making sure that everybody has room to explore that. Because, if we're saying, oh, like X, Y, and Z about people with NPD, or X, Y, and Z about abuse or interpersonal or intimate partner violence, like what we can often do is erase the initial victimhood of the person who has victimized us, and
Yeah.
not have the bigger picture of like it hurts all over and everybody has a place for healing separately within this bigger picture. I'm going to get off my high horse now.
No, I
I
agree.
lost
I
you
think
faster.
it's very good points. You're good. I like it. Maybe some people in the comments will be mad at you, but I'll yell at them. I'm the evil narcissist. I do that.
Or I can just keep an eye on them. I don't usually yell at people. I'm like, "No, you make sense. That makes sense that you would think that way."
Yeah. I mean, it's like usually when I would say 90% of the time when I disagree with people in terms of narciss, I just take it so personally sometimes. Like it's so frustrating. But whatever. Okay. Anyways,
You? A disorder that makes you prone to defensiveness?
yeah, weird. Weird
Taking
how
it
that
personally?
works.
I personally would never
Yeah.
be the most defensive person. I'm like, "What do you
So
mean
I
by that?" I'm like, "Oh, wait, hold on. That was a defensive part of me. We got it. We got it. We got it under wraps."
I've yelled at people in comments before. I've been like, oh, I did that
Yeah.
again, didn't I? I gotta chill.
Yeah.
Um,
That's where
but
learning to be accountable has really saved me, to be earnestly and genuinely accountable. I'm like, "You know what?
yeah.
I was being a little bit of an ass right there. I was being defensive, and that's not fair to you. I understand your point. Is there anything else you would like me to know?"
I'm getting there. I'm getting there. Like I
It's
every now and
it's
then I'll take back something I said, be like, that wasn't cool of me. And then I'll defend myself in a bunch of other ways. I'll be like, still didn't justify what I did,
If
whatever.
you ever need book recommendations on accountability, I got you.
I always need them. But okay, last question I have, just to wrap this up, because I think this is interesting. You also have avoidant personality disorder. And
Yep.
a lot of people watching this probably are not familiar with cluster C disorders. And so could you explain to everybody what having avoidant personality disorder is and like how you experience it?
This is something I haven't really developed a lot of the language to talk about, if that makes
Fair,
sense.
yeah.
So I was like, I guess if we were to use like the kind of subtypes of borderline personality disorder, which are very popular, popular psychology.
I don't like them, but
Yeah. No, but yeah. So what is always very funny to me is if like I'm like, are these people that just have comorbid avoidant personality or just have more internalizing behaviors?
yeah,
Um, so I find it all kind of difficult to describe. Again, when you got multiple diagnoses, it gets really complex. But there are definitely things that I have struggled with where just to use an example, like during COVID, I was thriving. I was like, I do not have to navigate the complexities of the world right now. I get to just exist on my own as myself. I don't have to worry that other people are constantly judging me, that something bad is going to happen to me.
same.
I don't have to look anybody in the eye. I don't have to talk. I don't have to do anything. And when I get in that space of having a lot of those kind of like wounds that underlie the reasons I have developed avoidant personality tendencies, right? Um, when some of that stuff gets kicked up, like I tried to go to the grocery store somewhat recently, and like people would get near me and I would just like crumple away from them and I just wouldn't want to look at them. And it becomes so hard for me to even be out in the world, um, and to not just feel like I'm just this disgusting, like, person.
Yeah.
Um, and I've
Like,
noticed, yeah, it's like that
yeah.
that's leads to like the I want to engage in the borderline behaviors. Like I have this
But
polarity in me that's like fighting at all times between like being completely alone and then being completely like enmeshed in other people. Um, to try to find like meaning or just to escape how bad it feels to feel when I'm in that space. I remember like years ago there was a time when I didn't leave my house for like a week and then I cried because I needed to go get cigarettes and coffee and I just like leaving the house I was like I am the most disgusting human on earth and the thought of anybody looking at me right now like makes me want to like rip my guts out.
yeah, I've like me off camera, you talked about this a little bit. Just that oh my god, there's such a similar because I feel like a lot of the core of both AVPD and NPD is shame. And when I'm in a much more vulnerable state, I'm not feeling very grandiose.
Mhm.
God, the idea of walking to my car and somebody seeing me is like I fucking hate it.
Yeah. Yeah, and, like, that's the thing. That's, like, another thing that I had to kinda think about for a while, and I was like, "Is this, like, a comorbid AVPD thing, or is this, like, an NPD thing?" Because that would be more likely, right? But I don't have those big swings into, like, grandiosity. I have some of them. I feel like any kid that got bullied a lot as a kid is gonna be like, well, yeah, well, if you think I'm whatever, but the thing is, it's like I was bullied about things that were true. Like I was like, I am
Yeah.
fat. I do cry a lot. like, you know, and so it became like there's something so wrong with my personhood that people are not safe. And like I was an only child and I just stayed in my room a lot and
Mhm.
you know, my family system encouraged, this to some extent, and I just became very withdrawn and very avoidant. Like I would just avoid things, and I have avoided relationships and social situations for a long time. And I think that contributed to a lot of my substance use in my late teens and early 20s because it made it easier to do the things.
Makes a lot of sense. I
Yeah.
like that's what like it's interesting to me just seeing avoidant personality disorders. I'm always like, man, when I'm at like my lowest, it
Mhm.
feels like avoidant personality disorder more. And it's actually, statistically speaking, that's actually relatively common, where like once a narcissist becomes diagnosed, they may adopt some avoidant features because they like are ashamed of the idea of being a narcissist, of that they've hurt people, stuff like that. And they'll shut themselves out from the world, don't want to be looked at and shit.
Mhm.
And it's like there's an interesting tie there that I want to explore a little bit further at some point. But yeah.
It's
Anyways,
it's hard to find literature that explores the comorbidities of like avoidant with cluster B disorders.
oh yeah.
Like,
There's
like I
barely no literature on fucking avoidant personality disorder, period.
what are people doing? Avoiding it?
Yeah, weirdly enough.
But yeah, that was a thing, and you brought this up when we were talking earlier off camera. Um, you know, that it was hard for you to picture somebody with borderline personality being anything other than preoccupied in their attachment
Yes.
expression.
Yeah.
And it's so interesting because it's like, yes, research does support that the vast majority of people with borderline personality are going to express themselves in a preoccupied fashion and then a disorganized fashion. And then there are people who are avoidant that are represented, right? And it makes me wonder, and like I've often wondered how we're using the in like popular psych discourse or how people are using the subtypes. It's like if we're talking about quiet BPD or discouraged BPD, it's like, are we describing that comorbidity? And like, where's the research on that? Because as somebody who would identify, a lot of people, if you were to ask them, it's like, oh, does Andy seem like somebody who has BPD? People would by and large say no, or people
Yeah.
find it very hard to believe that I have it. And I think that is because of my heavy like avoidance. And the avoidance affects me more than day-to-day things. Like I avoid, that award that I won. I
Yeah.
was like, I cannot fathom going to that. Like that would be so weird. I do not know what to do. I do not want people. I do not want to interact with people. I'm not going to win an award anyway, so why would I go? But like I didn't go to my graduation. Like I don't like it. I don't want to be seen.
Makes a lot of, I mean, I makes a lot of sense. I mean, well, in fairness, I skipped out on my graduation, but that's just because I didn't want to go. But I was bored with it. But yeah, no, it makes a lot of sense. It's interesting. Okay. But yeah, I think we'll wrap it up here now. Thank you so much. Where can people find you on social media if they
No,
do? Unless you don't want them to find you, then I
it's
guess we
okay. No, no,
can.
no, no, no. We're good. Yeah, I'm
Okay.
really only on TikTok. Um, when it comes to talking about this stuff, if people want to find me on Medium and read my research, that's fine. Totally unrelated to what we're talking about now. But on TikTok, I am Andy Lynn Evans. So that's ANDYLYNNEVANS. Um, and that is pretty much where I exist. On the internet, you can reach out to me via email if anybody wants at edfoodjustice@gmail.com. But other than that, I'm a ghost.
I respect it. I'm the opposite at this point.
I was gonna say you're all over the place. I
Yeah.
wish I could. Like I'm trying. I might start a Patreon soon. People have asked me to do video essays, especially about my research, and I'm just like,
Yeah.
I don't know how. I don't know. It seems like a lot of steps, man.
It isn't. It's weird. I just set up. I have a stand for my phone, and I just talk to it, and people like it for some reason.
And yet, I'm sure under that, you're like, how could people like me? Why are they watching me? But I hope they do, and please do it more.
Yeah, it's. I'm not going to talk about it. Well,
It's
that's a video
conflicting.
idea for later. But okay. So thank you everybody for watching. Y'all have a good day and take your fucking meds, please.